Good morning, Carol Johnson.
And a good morning to you, Bob Ponce.
Okay, so we are back for our weekly COVID update, and everything we told you, unfortunately, is coming to pass. So I don't know what to tell people, um, but we'll tell you the truth. That's what we do. So the
Yeah,
truth is as we said, the numbers are going back up again here in New York City, and it's a result of people backing off of the protocols while this Delta variant is taking shape and form. But the real bad news out of that, so there are two kind of hot spots in the city. One is out in Staten Island. They are the hottest spot in the city in terms of COVID. And the second hottest spot is right here in Central and East Harlem, zip code 10037, where 5.6% of the people tested over the last 7 days have had a positive result. And this is like, the rest of Harlem is more like around 1.7%. This is a huge, huge breakout in our own backyard. And, we need to address it.
absolutely. And the other hot spot was right here in East Harlem,
Mm-hmm.
10035, which at one point was the hottest area in Manhattan.
Mm-hmm.
Between uh, 35 and 10029, they were the two hottest spots in all of Manhattan. And
Mm-hmm.
I don't know if it's a matter of people not wanting to be left out of the party, but the bottom line is the numbers are going up again. And,
Mm-hmm.
you know, we understand that people wanted to get out and they were tired of being locked in and what have you. But we tried to warn people that that's not the way to do it. You still have to do it safely. And obviously, that's not being done.
Mm-hmm.
So I'm seeing people are going into stores, the bigger stores, like the
Mm-hmm.
Targets and stuff like that. And, the guards are kind of looking at them, but they're not really insinuating that, insisting that they put their masks on.
Mm-hmm. And, to compound this, we have this other article that was in patch.com mentioning that the mayor has no plan to bring back mask mandate despite the Delta variant. So, so in other words, you got to be on your own. You're on your own. Yo.
Yo,
Once
yo, yo.
again, um, you cannot necessarily rely on the information that we're getting from our public officials. And part of this problem came from the CDC that told people that, once you got vaccinated, you didn't have to worry about wearing a mask again. It was like this bargain. Just get vaccinated and you don't have to worry about it. It'll all be behind you. And it's just not really true, you know.
And they're not all saying the same things because I remember Fauci saying you still had to stick to the protocols. And I also remember him saying that if we didn't, they were going to see a major spike again in October.
Mm-hmm.
He just said this like a couple of weeks ago, and I had heard it already before that, him saying that before that you
Right.
still can't let your guard down. So
Right.
there's just so much information coming out from so many different places. But there's one thing that you can trust: the numbers are going up. So who are you going to believe? In terms of its transmission,
Mm-hmm.
the rapidity of the transmission,
Mm-hmm.
uh, and the dangerous nature. This is, if you look at this compared to like Sandy and Irene, how they thought that Hurricane Sandy, Superstorm Sandy, was going to be like the little sister of Irene.
Mm-hmm.
Irene came in and hit us with a wallop. They said, Sandy's coming. She's just a little sister. She's just trying to bite off the little sister's fame.
Yeah.
Sandy came in and beat us like we had stolen something.
Right. Yeah.
Sandy whipped us, and people are still going through devastation. People right here in East Harlem still have major damage to their apartments. Forget about the Rockaways and Queens and areas out there like that. But this is the same thing. You're looking at that, and you look at the novel coronavirus 19, that first one, and then you look at this Delta variant, and this Delta variant just sort of eased in. This ass, no big deal, and
Hmm.
she's hitting people with a wallop now.
Hmm. You know, and going back to the decision of our mayor not to have a mask requirement, this is a complete contrast to what happened in LA, where, you know, with the Delta virus spiking, they went back to a mask mandate. I know, you know, it's tough to say I was wrong and we still need to do this, but there's an obligation on the part of our health officials and elected officials to make decisions based on the changing information, not based on how you're going to look with regard to the decision.
And the sad part about it is that people are still getting sick, and
Mm.
we still don't know how long the symptoms of COVID last.
Hmm.
So you have people that have recovered, but they're not recovering well. Like
Hmm.
70% of those people are not recovering well. So there's no real data on what's happening with this Delta variant, how people may have recovered from it, but what are the underlying issues? And the bottom line is, let's face it, we all want to live happy, healthy, and free. So
Hmm.
take a risk at getting something that just is so horrendous and remain sick. Once this thing is in your system, you have absolutely no idea what havoc is going to wreak, even if you survive it.
Hmm.
So to take those chances is just unconscionable, that people are not paying attention. They just absolutely want to go out and just act like it's over, and it's not over, people. And until we stop and pay attention, I'm not listening to the mayor. I'm not listening to the governor. I'm not removing my mask because I know that's best for me. I am still going to distance myself from people as much as I can. And I know that's difficult in New York, but I'm going to distance myself. If that means going to stores certain hours of the day when you know it's not crowded, you know, and being inside. It's a heat wave going on now. So, being inside at the time when you see most of the people are milling around.
There's another story that I want to talk about, and this is about the American Academy of Pediatrics, which is obviously an organization of pediatricians, have come out with their own guidance on masks and for students. And according to the American Academy of Pediatrics, all school staff and students over 2 years old should wear masks when they return to school this fall, regardless of their vaccination status. So they issued this guidance Monday. It's stricter than what the CDC is calling for. And they said, based on studies from 2020 to 2021 school year, the CDC recommends school maintain at least 3 feet of physical distance between students within classrooms, combined with indoor mask wearing by people who are not fully vaccinated to reduce transmission. But they feel that everyone should wear a mask in a school, period. So this is what the pediatricians are saying, and I thought you should know.
Yeah, I mean, these are wise decisions. People are saying a lot of stuff out there, but it's
Mm-hmm.
something you have to look at what's wise. If there's the slightest chance
Mm-hmm.
that you will not get this virus by sticking to certain protocols, then that's what's advised.
Mm-hmm.
I mean, you don't want to take a chance on your life, your child's life, and even though kids are not doing as poorly with it as the adults are, but then we had the time where the kids were getting it. There was masses of kids, and all of a sudden you stop hearing about that. Like
Mm-hmm.
50,000 kids in Florida, and they started to compare it to something called Kawasaki's disease. However, then they were able to say, no, this is COVID, and I think that's part of the problem too, is that you get information, it circulates for a minute, and then it stops, and so people assume that, well, when the information stops reeling, then it must be better. We can return to norm. No, no, no. That's the wrong way to look at this thing.
Mm-hmm. The other thing that's good about this recommendation, which is to have all kids wear a mask, is it doesn't separate or stigmatize the kids who are vaccinated versus unvaccinated. Because if you have unvaccinated kids not wearing a mask and vaccinated kids wearing a mask, now it becomes a thing about who's been and who's not. And what we already know in schools is that only vaccinations have only been approved for the age 12 and above. So there's already elementary school kids are for the most are not going to be vaccinated. You're going to have that area in the middle where you might have a mix of ages that are on the borderline. But the fact is that they're still just trying to get the vaccination program going with children. But in the meantime, masks have been the most effective thing at cutting down transmission. And the idea that just have all students wear masks, to cut down transmission and, not have this carve out for people who have been vaccinated, because that's not working with adults and it's definitely not going to work with kids. So I give credit for the American Academy of Pediatrics for taking a stand.
And we already know that bullying has reached epidemic proportions in schools. A lot of children are, you never heard of children, committing suicide and everything. And I
Mm-hmm.
just see this as another aspect to add to, that bullying syndrome,
Mm-hmm.
where, if the kids were masked and those weren't masked, that the ones that weren't, that were masked, that the other kids may attack them. You know, oh, you must have
Mm-hmm.
something. Your mother must have something. Because you're wearing a mask. And that's a great point that you brought out. They're not being segregated. They're not being separated.
Mm-hmm.
As should be the same in the society.
Right.
You know, yeah, walking down the street, there's no one around you. You're riding on your bike. I'm zipping up the street in my scooter. I have all this free space around me. I can pull it down. Going into open air spaces, parks, and different things like that where people are walking around, it's
Mm-hmm.
still airborne. You know, um, Not a good idea.
Mm-hmm.
Not a good idea. Still have to separate and separate your chairs. And when you're off at a distance and you have a group in the park at a cookout, yeah, and everybody's separated, and you can put your chair where you want to put it. You can take your mask down. You can relax it. But when you're getting
Mm-hmm.
close to people and you're on that buffet line and everybody's lined up right behind you and in front of you, trying to get those baked beans and that frank, no, pull that mask up.
Absolutely. So I mean, common sense is not as common as it's supposed to be.
Well, it hasn't been common in quite some time.
Well, I didn't want to say that, but
I'm sorry, and you didn't hear it here first.
yeah.
I mean, but I really hope people can have a wonderful summer. And you know, I know for me, when I do the right thing for me, because I can't make anybody do anything.
Mm-hmm.
I'm not worrying about certain things. I'm not worrying about getting something. I'm not worrying about, you know, um, going places, what have you. But it's like anything with emergency preparation. When you know a little something, you can be more at ease.
Mm-hmm.
When you know that you have all your ducks in a row, you can be at ease. Now, even though we may have this knowledge, that doesn't mean that I'm going into a closed space.
Mm-hmm.
I'm not doing it because even with the vaccines, we know that people can still get infected. We know that people can still be asymptomatic, and so that's taking really high risks, really high risk. So I still want to be, if I'm going to be in a closed space, it has to be under certain circumstances, a big area with a few people.
Mm-hmm. Yep. So another article about the fact that up in Massachusetts they have some COVID sniffing dogs, which is interesting.
Yeah, I saw that before. That is extremely interesting.
Mm-hmm.
Are people going to be snatched the way they were with the
Like
narcotic
the
sniffing dogs?
like the drug dogs.
And I'm like, the person has some kind of exotic tea in their bag, and next thing you know, the person is
Yeah, like
thrown on their face and handcuffed and drug off. You know, I mean, I'm not sure what those dogs were always sniffing, but
mm-hmm.
there were many cases where no, it was not weed, Fido. So I don't know. I think people are grasping at straws. There was something else, a COVID tracker. Let me see if I can find it. It's a COVID tracker where it would tell you if you were within a certain proximity to someone who had COVID.
Mm-hmm.
Oh, COVID alert, they called it. And you're supposed to log in, if you had symptoms. And somehow this thing was supposed to let you know if you actually had been in a closely aligned with someone
Mm-hmm.
that actually had COVID. Now I don't know how that was supposed to work, but I think now there's been a lot of grasping at straws, and agencies need to be sitting at the table or on Zoom. Wow. Well, you know what? They need to be sitting at the table because if they're opening up the city and going to the movies and going to all the sports arenas and everything, then they need to be sitting in the room
Mm-hmm.
talking about this, putting all this stuff on the table, and then actually being able to tell each other that's crazy. That's crazy. We can't put that out. You know,
Mm-hmm.
we need to tell people this. We need to keep that back. But there's just too much information all over the place. So I understand why people are confused. But we still had basic principles to this thing, basic stuff. Wearing
Mm-hmm.
a mask is not new.
Right.
We've been doing that 18 months. So that
Mm-hmm.
should catch you off guard.
Mm-hmm.
Washing your hands when you come in, you know, that shouldn't catch you off guard. Wiping off your countertops, that shouldn't catch you off guard. Distancing, socially distancing, those things should not be catching you off guard. And the more you can adapt to that, the sooner we can get out of this thing. If those things are not adhered to, the longer we're going to be in this. So we'll be
Right.
here this time saying the same thing over and over and over again, unless you just stick to those basic principles, which
Mm-hmm.
are not difficult.
Mm-hmm. That's it. As our brother Mark is saying, many people not getting the vaccine based on misinformation. And it's just about looking at the numbers, at the data at this point in time. And we're not saying there's anything wrong with being skeptical. We've all been given plenty of reasons to be skeptical about things such as this. But at some point in time, you have to evaluate the information that's coming and acknowledge the fact that everybody in the system is not out to get us. We have black doctors and black scientists. We have people who have reputations there of basically being only one to help people. And so there's a lot of people who are looking at the data and monitoring it. And we're at a point where we've had, 150, 200 million people have been vaccinated. So there's a very large data sample that we can look at. And it becomes very, very clear when there are problems almost immediately with numbers that large. So the thing we can say is that the vaccination program has been, for the most part, successful in terms of bringing down these numbers and fighting the spread of this COVID. So, it just really comes down to a matter of what the risk is. The risk is between, whatever you have been told that the vaccine is going to do for you, basis what can happen if you don't have it. You know, and we're not trying to make anybody's health choice. I think that most people, if you have a question on this, you should actually go to your doctor and sit down with your doctor and talk to them, and make a decision based on what's best for you, based on a conversation with an actual health professional, not with a Google doctor. Because there's a lot of Google professors out there, and there's a lot of people who are just taking information that's unverified and using it to make decisions. That doesn't make any sense, you know.
And again, not getting information from those professors from UCLA, the University of the corner of Lenox Avenue.
Mm-hmm.
People making up stuff as they go along. The gurus with the papers rolled up under their arms, standing there, just
Right.
you know, pontificating. I mean,
Mm-hmm.
and I know that a lot of us don't in our neighborhoods don't have doctors, but that's not going to stop you from going to a medical facility and just informing them that you wish to speak to someone in in the field. And you have the vaccinators, you have people that are nurses and doctors and different people that's going to give you the same information. All facilities are not going to provide an actual MD,
Mm-hmm.
but they do have people who are physician assistants, nurse practitioners, different things like that, the vaccinators, people that have that information that can sit down with you and help you make the wise and healthiest choices, but certainly not through a computer or just
Mm-hmm.
listening to someone who, even if someone is a doctor, that doesn't mean they're an immunologist. They don't Doesn't mean they know anything about the virus, how it mutates, how it acts. It doesn't mean anything. I doubt
Mm-hmm.
if my podiatrist is going to give me that information. But if you go to a medical facility, they will. You can find someone that will give you that information.
Mm-hmm.
And then you have to question the information, weigh the information that you're getting. What is your fear? You know, there's risk with everything. And not only are there black doctors that were involved in the creation of this, but you also have black people that were actually taking their lives in their own hands in the trials. Blacks, Puerto Ricans who were taking this. It's one thing for us to get the vaccines after the trials have been done, and the risks have been ascertained. But you had people that were actually saying, well, you know what? I'm going to be a part of this trial. And you're taking something that people didn't know anything about the side effects, what was going to happen to them. But they took a chance. Now, the question is, was for me, am I willing to take a chance on my life? Because I got that little dash between my date of birth and my date of death that I can't do anything about anyway. You know, when that dash is up, it's up. So I don't think in terms of, oh, this is going to happen, that's going to happen. Again, people are taking vaccines for flu, which is going to change. That flu vaccine, I think it's what, every 6 months or 8 months. They said they're going to try to issue it. That vaccine changes every year according to whatever the premier flus that's out there. Taking the shingle shot, the pneumonia shot, you're taking all of these different shots. And then all of a sudden you get to this vaccine, and all of a sudden everybody like, like, no, I'm not doing that. Make the wisest choice and make sure that you make the decision based on some facts. So
So I think that's all we really need to talk about today. You know, I wish we had better news, but you know, I'm not trying to say we told you so, but we did. We've been, you know, 2 weeks, 3 weeks, 4 weeks ahead of the curve consistently on this thing. And when they backed off on the protocols, we told you don't listen. And now here we are, and we see the numbers bear it out. And so it's just common sense. That's what we have here. We have common sense. We read everything that comes out. We don't listen to scary stories. We look at the research. We listen to everybody, and we're critical of everybody. Just because the CDC says it doesn't mean we agree with it. Just because the governor or the mayor says it doesn't mean we agree with it. But it doesn't mean you don't listen. You got to take information in and really use a higher level of common sense about it. And the thing about it is that we figured out what actually works and doesn't work. The masks is the number one reason, not the vaccines. The vaccines didn't even show up until January, February. We started wearing masks before that, and that's what started bringing the numbers down. Now in combination with the vaccine, it brought the numbers down faster, and we're trying to eradicate it. But it doesn't mean you stop in the middle. The game is not over. That's like, it's like in the third quarter and you're up by 10 points, so you stop playing. No, you got to keep playing to the end, because this virus is very, very adaptable. It's highly adaptable and is going to take any opportunity for you to ease up on the protocols to come back and infect more people. It's what it does. And there's no reasoning with it. And it affects everybody. This virus has hit everybody. We know it hit Black people hard because of inadequacies in the health system, but it hit white folks hard too. And right now, it is hitting people in places like Arkansas. You think our numbers are we're talking about our numbers going up here, and we saw the worst of it last year. We saw it in March and April of 2020. But we have places in this country that are seeing that type of environment right now, where their hospitals are full to the brim, and people are dying at a crazy rate. We don't want to go back to that. We got out of that. So I don't understand why people are starting to get amnesia about what we went through last year. You know.
absolutely, yeah. And it started over in areas like that. It started in the West Coast.
Mm-hmm.
And the West Coast is starting to, turn red again. But again, the governor did step up and say, no, we have to stop this. We've got to go back to mask. Areas like Florida. Florida was on fire. You know, they're down there saying, they're not mandated. But the bottom line is, um, these people, anyone that's telling you to take your life into your own hands like that, put you at risk. I wouldn't be listening to them. You know,
Mm-hmm.
mostly everyone knows someone who, if they didn't know personally, someone who died from this disease. They know someone who knew someone. And last year it was almost as if we all just moved into funeral chapels. We were in Zoom rooms every day, all day. And as soon as there was a break, then it started all over again. I don't want to see that. It got to the point where so many people I knew so many people that lost their lives to COVID that I just couldn't show up. People wanted me to sing at the services. I just couldn't show up. I just couldn't do anymore.
Hmm.
It was wearing. So, I know there's fear involved, but fear can make you, it's either false evidence appearing real. Fear can make you forget everything and run, or it can face everything and let's work to recover. So we have options. We have a lot of options out here. I
Hmm.
just say for you and your family that you sit down as a family. And that's another thing. You need to be doing it as a family. Parents with your teenage kids, you need to be doing it as a family. Because a lot of kids they find have gotten infected, weren't getting sick, were asymptomatic, but had more of a chance of spreading it quicker than the adults could. And so you got to be really, really careful. You need to sit down with your kids, and especially now, with summer and everybody's having cookouts, and you have to put a some type of a fence around a girding fence around your household, and sit down and have this conversation with everybody who's coming and going.
There it is. All right, so this has been our COVID update for this week. We will be back, God willing, next week on Wednesday at 9:30 to give you the latest information on the pandemic.
So as always, have a safe week, and we'll see you